Okay. Make sure I can see everybody. Clarence, I can only see your forehead. If you could put the camera down so I can see your face, that would be great. I still can't really see you, Clarence. About half your face. Okay, thanks. So you should have quiz 4 uploaded into your gradebook. Okay, so why don't we start there? It's 9:03. So let's take 15 minutes to do your quiz. Make sure you submit it when you're done, and then we'll go ahead and review that. Everybody needs to stay on camera while they're taking their quiz. Okay, so go ahead and get started with that. Does everybody see it in the grade book? Yes? Okay, great. All right. I'm going to mute myself. We'll see you in a few minutes. Hey, is everybody done?
I'm on the last one.
Okay.
Me too.
Okay. Clarence, you done?
I'm
Yeah.
done.
Okay. Okay. Looks like everybody's done. Everybody could go back on camera. That'd be great. Okay, Skylar, I can't see you. Just looking at the ceiling. Thanks. Randy, you there? Okay, how'd you do? Did you do okay? All right. Let's review the questions. There's one surprise question in there that I'm going to give back. We'll get to that. It was confusing, and I've heard that from both my other groups this week, so we'll get to it and I'll show you which one. Okay, let me share my screen. Hey, can you see my screen? Yes?
Yes.
Okay, thank you. Okay. Which statement about vulnerable populations is not true? What's the right answer here?
Lower mortality rates.
C is the correct answer because C is incorrect, right? We know that vulnerable populations have higher mortality rates, right? And we also know that vulnerable populations, this is A, often have poor health outcomes. That's correct. We know that vulnerable populations have higher rates of communicable diseases. That's correct. C is not correct. They have higher mortality rates, which is why it's the correct answer. And we know that vulnerable populations are exposed to higher levels of crime and violence. So this is a good review question about vulnerable populations. Okay, that's a pretty good overview about vulnerable populations. Question 2. Which of the following should be the initial consideration made by a nurse who is working with vulnerable populations? What's the key word in this question?
Initial consideration.
Initial. What's the first? So what's the first consideration made by a nurse working with vulnerable populations? We have gone over this in class the last 2 weeks.
Personal feeling.
Right. Did anybody get this question wrong? I can't go in and look at everything individually, but this is critical in understanding. Okay. The nurse working with the vulnerable populations, having an understanding of your own personal feelings, of working with members of the vulnerable population, whether it's homeless, whether it's teen pregnancy, whether it's LGBTQ, whether it's clients with mental illnesses, substance abuse, alcohol issues. Okay, it's not that the other answers are not correct. Again, like I've probably said in every quiz, this is a good question, a good example of if it looks like more than one or two answers could be correct, what should you be doing?
Rereading the question for the initial consideration part of it.
Exactly, Megan. Yep, yep. And let me ask a question. Do you guys use highlighter in ExamSoft? I was discussing this with a student yesterday, and she wasn't aware that that was available. Do you guys use the highlighter in ExamSoft? Do you know what I'm talking about?
I do.
Okay, Skylar, explain the highlighter to the group.
It's like a little tool at the top that you could just highlight what parts of the question are important.
Did anybody else use it besides Skylar? Is it helpful, Skylar?
I think so, because I constantly second guess, so I go around the question 100 times. So highlighting it makes me go back to just the important parts of that question.
Yeah, so I'm just going to stop sharing for a minute just to see everybody. Does anybody else besides Skylar use the highlighter?
I do because
Celine
I'm
uses, okay.
yeah, I'm second guessing like Skylar say.
Okay. It's available to you, and I've heard from students it's a very, very useful tool because when they go and read the question, they can highlight a word, a phrase, a cue, so that when they go back and read the question a second time, that particular word, phrase, cue sticks out. So if you don't use it, I would highly encourage you to, because for questions like this, you can go ahead and highlight initial consideration or initial. Okay, so this question is asking, well, let me back up. So the highlighter is available to you. I'm going to ask Skylar, since she jumped up and answered that. Do you also use the tool that crosses out wrong answers?
No.
I've tried to find it, but because I know it's there, but I've never been able to find it to cross out the answers.
Does anybody use that?
No.
Okay, there's a tool in there that allows you to do that. So if you go through and read the question the first time and you know you can throw out an answer, you're able to go in and put a line through that so that if you go back and read the question a second time, that answer is not even in there for you to think about. Those are the two tools.
Do you
An
happen to, I'm sorry to cut you off. Do you
No.
happen to know where that tool is on ExamSoft? Because I've personally never been able to find it.
I do not, because I'm not into I can't go into the setup of the exams, but I'll find out. How's that?
That'd be great. Thank you.
Find out and let you know. So what should be the initial, so we did that, initial. So this is a question that other answers could be correct. Okay, so if you're working with LGBTQ, right, understanding of the same-sex marriage laws in each state, that's important. Assessing the family structure, working with a homeless family, that's important for consideration. Assessment of gender identity and sexual orientation in a safe environment, that's important as well. Right? So if the question didn't ask for your initial considerations, everything could be correct, right? So again, another good general overview question about caring for the vulnerable populations, right? Question
I have
3.
a question.
Yeah.
I'm so sorry.
No, go
So
ahead.
with that question, because I was stuck between A and B because they both said understanding.
Mm-hmm.
So what is the difference between understanding the same sex versus understanding the personal feelings?
Okay, great question. Great question. Because it's asking what is the first thing we need to think about. And one of the things that we've gone over in class repeatedly is we have to have an understanding of our own personal feelings, biases, working with members of the vulnerable population. That's the first thing we have to consider. So that key word, initial or first, leads you to answer B. It's not that A isn't correct, but you have to do B before you do A. You have to
So
do.
it's
Go ahead.
the personal feelings is kind of like the key word because you need to,
Right.
okay.
You know, especially if, I mean, there's a lot of people, including nurses, that have feelings, whether they're biased feelings, prejudice feelings, uncomfortable feelings, right? Those have to be dealt with before you can competently care for special vulnerable populations. So B has to happen before A, B has to happen before C and D. It's just the first thing that has to happen. And there may not be. I mean, there may be no issues with personal feelings. But if there are, how are you going to competently care for a population that, you know, if you, let's just take homeless. You know, when you drive through your community or drive through other communities and see homeless people or camps or whatever, what do you think about? I mean, a lot of people have different feelings. And if you're actually going to be in the community taking care of these clients or working in a shelter, whatever biased feelings you might have about this population need to be resolved, or else don't care for that population.
Okay. Thank you.
Does that help?
It did.
Okay. All right. Great question. Okay, so Sarah's discussing discharge with the new nurses during orientation. Which statement by one of the new nurses will Sarah need to correct? Number 1, what kind of question is this? What kind of framed question is this? Positive or negative?
Negative.
Negative. So knowing that from reading the question, what should we be looking for?
False
D.
answer.
Something that the
We should be looking
new
for
nurse
what the wrong
says.
statement is.
Yes.
That's
Yes,
negative.
Megan. Exactly. Something that this new nurse states that is either incorrect or needs more education or needs more content to her answer. So what does this new nurse say that is going to need to be corrected?
D,
Right. Why is the answer D?
because discharge begins on admission.
Exactly.
And while the social worker does have a part towards the end on getting them set up with outside resources, that's not when discharge starts. So
Exactly.
I chose that one as the wrong answer.
Yep, that's right. Everybody get that. C is actually the correct answer, right? Or the correct thinking, right? Discharge begins on admission.
Wouldn't all three of the choices besides D be correct? Because they do feel they constantly want to go home. And then the healthcare provider has to start the orders.
That's exactly right. The other three are supposed to be correct because there's only going to be the one negative answer for this question.
Right. Right. You're right. All the other ones are correct. Right? You're looking for something that said that we know is not correct, and that would obviously be D. Skylar, does that make sense?
It does.
Okay. Okay, a patient is newly diagnosed with diabetes. The patient will need insulin injections. The patient is unsure how to administer insulin injections. Which reply by the nurse will gain more information from the patient? What do you think?
Asking them to share their feelings about their disease process and how to administer their own medication so that you can get an idea of where they're at and how to educate them.
Yep. And in your preparation for class, when you were reading about teaching and developing objectives and learning outcomes, it's always one of the initial things you need to do is explore feelings, right? Because you really have to have a feel of how the client is thinking or feeling before you can really develop a plan to start working with them, right? Are they anxious? Are they afraid? Are they resistant? How are they? What are they thinking? May lead you to will lead you to developing whatever kind of appropriate education or teaching you need to do with them, right? Question 5. Sam is being seen in the clinic today. He's a high school graduate. There's several pages of discharge instructions. The nurse can assess his ability to read and comprehend written instructions by doing which of the following?
B?
B is in boy,
Yes.
right? Graduation from high school does not guarantee reading comprehension, correct? You read that in your notes. On C, we don't really care when you graduate from high school. And asking directly, can you read, is really not it's more of a judgmental question, right? Working with this client, having them read something and then discuss what's being read will give you an idea of reading abilities and comprehension. And we'll learn as we go into the content, one of the biggest barriers to learning is low literacy. Okay, the patient's inability to read and understand, more so understand what they're being taught. So we have to be able to assess that. Okay, and even family members, that are there that you might want to pull in to do the teaching. Are they able to comprehend? There's a lot of variables when it comes to teaching. Okay, question 6. This is the question I'm going to give full credit to. Okay, Lisa knows that low literacy is a learning-related barrier. Which of the following statements by the clients indicate the client is experiencing a learner-related barrier to new information? Okay, A is fine. Okay, I know about the disease. I have several family members with it. That's an okay statement. Okay, the rest are not. I know the correct answers marked in there were B and C, but I've added D in there. Okay, I don't like to read. Just tell me what I need to know. That's not appropriate. Okay, they may not be able to read. Okay, just tell me what I need to know. Well, a lot of clients that have low literacy are sometimes unwilling to share that or embarrassed to share that, right? So I don't like to read. Just tell me what I need to know as a red flag. I will figure it out. Just tell me what's important. Red flag. It can't be that hard to learn. I only have to take the pills, right? I was thinking for D that at least they're asking the question. I only have to take the pills, right? But my students in my Monday and Tuesday class convinced me that this was also a red flag. It can't be that hard to learn. Okay, so I've added D as a correct answer. So I'm just going to give everybody a point for that question. Okay. Do you
Thank
see?
you, because I was very confused
Okay.
about that one.
Yeah. Okay. But do you see how B, C, and D are red flags? I mean, if you took everybody at their word, there's a good percentage of that's they're not understanding, right? Okay, the nurse may conduct an assessment of the workplace. This is occupational health. The nurse may conduct an assessment of the workplace, which is known as a worksite walkthrough. Direct observation allows the nurse to learn which of the following. Select all that apply. This is a great question of an overview of what occupational nursing is all about. Okay, all 4 answers are correct. Okay, and we'll talk more about occupational health in the content when we get to it, but think about it. If you are an occupational nurse, you're in a workplace. That's what occupational nursing is, in the work setting. Okay, it doesn't matter if it's a hospital, an industrial plant, a fast food, it doesn't matter. Every workplace has oh, go ahead, Megan.
I'm sorry, I just had a question about this one because I got a little hung up on this one.
Okay.
I didn't select the requirements
Okay. I'm going to explain that.
of various jobs because the question says direct observation. So I didn't pick that one because if you're just walking through and like watching everybody directly, you don't always see the requirements of the job. Like there's certain things that they don't do right there that you wouldn't have
Well,
seen. You know
in
what I
your
mean?
notes, it talks about one of the jobs of the occupational nurse is she needs to know what the requirements are of the various jobs, right? What is in their job descriptions. So when she's doing her workplace assessment, she can be, if let's say she's observing in hospital transport staff, right? With the lifting and the transferring, she needs to be aware of what safety protocols are in their job description so that she can observe them transferring patients, lifting patients, that she's doing it right. So that's one of the jobs of the occupational nurse, is knowing what the jobs are.
I understand. I think it's just the way the question was written because it says direct observation allows the nurse to learn which of the following. So if the nurse has to know what it is before that, then the nurse would have learned it before the direct observation happened. Do you know what I'm saying? Like she probably read something about the requirements of the job before she went out to like visually observe. So that means that she learned it before she walked through. So that's why I was questioning that one because she would have had to have known that before the observation occurred.
Okay.
So I didn't select that one.
Okay. Direct observation. I don't want to get too much into the weeds here, but direct observation allows a nurse to learn the requirements of various jobs. That is intended to, that's just an assumption, not an assumption, that is a expectation that the nurse needs to know the requirements of various jobs so that when she's doing direct observation.
It's okay.
So,
I just read too far into it. And I do this at least once a quiz.
So the
Sometimes
occupational nurse,
overanalyze.
okay, the occupational nurse needs to understand what kind of environment it is. What is the work processes in that environment? What are the materials used? Job description, what's in the job description? The job description for somebody working in the transport department is going to be different from the scrub nurse in the OR, which is going to be different from environmental services, right? Or a radiology tech. Okay. The occupational nurse also needs to have an awareness of what are the potential hazards in each of these areas. Think of the potential hazards in a hospital versus an industrial plant. Okay. And then part of the direct observation is work practices of the employees. Are they performing safely as to prevent any kind of injury to them or a client? So these are four areas that are part of occupational health nursing. So all applied. Question 8. Mary the nurse knows there is no safe occupation or profession. One of the regular scheduled primary interventions Mary will implement is, what's the key word? What's the key word in this question? If you were Skylar and you were using the highlighter, what would you be highlighting?
The primary.
Primary. So what's the right answer?
Provide safety education.
Right. Right. You're trying to provide safe. I mean, we've all started new jobs where we've had to go through training, right? Part of that training is safety training, is it not? Okay. What is B? Primary, secondary, or tertiary?
Tertiary.
Why?
Because you're treating something already, so it's already been screened for, found, and now it's being treated. It's the end result.
Okay. What is C?
Secondary.
Screening. What's D?
Tertiary.
Why is it tertiary?
Because they're they've already been screened and diagnosed, and now they're going for a treatment,
Yep.
which is the surgery.
Yep, they already have an injury. Now we're trying to manage that injury or treat that injury. Does everybody understand those three? Why they're secondary and tertiary? Okay. Which step of the ethical decision-making process is identifying the ethical issues in the situation? Think of your ADPI here. Think of your nursing process.
It's the first one.
Okay. Right. You have to have, before you can go through your ethical decision-making process, you have to have an issue. It's like before you develop a teaching program, you have to do an assessment of what the learning needs are. Right? Before you can start something, you need to know what you're working with. Does that make sense? Home health nurse works in a community with high rates of complex chronic illnesses and neurological disorders. Which environmental characteristic is a priority? What are you going to highlight here?
Priority?
Priority. Okay, so this is an environmental health question.
It's B, the presence of several manufacturing plants near the community.
Right. That is potentially the environmental factor that's going on, or actually the primary environmental factor for a community that has high rates of chronic complex illnesses and neurodisorders. That's a big factor. Anybody ever see the movie? Oh, go ahead. Go ahead,
I'm sorry,
Simone.
I just had a question about D. It said something about the homes and school buildings were built after 1992, but it was like 1970, right? That had to
78.
do with 78. Okay, with the lead.
Yep.
That was the only question I had.
Okay. Okay. Did anybody ever see the movie Erin Brockovich? When it's about a large company spilling contaminated water, spilling contamination into water. Okay, and this water was contaminated and affected a whole community. Okay, people were coming up with cancers and chronic neurological illnesses, reproductive issues. Has anybody ever seen that movie? Nobody?
I remember my mom watching it when I was younger, but
Yeah,
I never, I was,
It's
Yeah.
it's about environmental health and actually an environmental disaster. All right, let's bring up our content and see what we additionally I want to cover about occupational health, environmental health, learning, or barriers to learning and reinforcing education. So these are our week 6 notes. Okay, this first bullet talks about the first couple talk about what the environmental nurse's role is, right? So as the nurse is conducting an assessment, they are going to learn about work processes, requirements of the job, potential hazards, work practices of the employees to observe effectiveness of safety education. And that's really the role of the occupational nurse, is to ensure a safe work environment. Okay, their goal is to keep employees at work, not absent, and functioning at their full capacity. And that's what occupational health is. The occupational nurse does many other things other than what we talked about and what was in the quiz questions. They also deal with work injuries. Employees get hurt at work or get hurt outside of work, and it affects going to work, right? So occupational nurses working with employees that are injured, working with HR, trying to figure out leaves, trying to figure out what has been done to treat their injury. Have they had surgery? Trying to work with them coming back to work. Do they have to come back on limited duty? Can they come back on full duty? Okay. What are their discharge instructions? Do they have restrictions? I mean, somebody has to coordinate all that, right? In large workplaces, things happen. People get injured, whether it's on the job, outside of the job. Okay, the occupational department is working to ensure safety in the workplace. Okay, as it's stated in one of the quiz questions, there is no work environment that's completely risk-free. Every single industry is at risk and has serious hazards related to work. Think about it. Let's think about where you work. Wherever you work. I don't know where you all work, but why don't you share for a minute? What are some safety hazards in your workplace? Chemical storage,
proper needle disposal.
needle disposal. Excellent. Yep. What else? What other hazards are in your workplace?
Risk for posters movement, posters to rising up improper something.
Say that again, Celine.
Proper. The risk for raise something improper or lifting something improper.
Okay. All right. Anybody else? What are some other hazards in your workplace?
Communicable diseases, like making sure we wear all of our
PPE.
protective equipment when we go into a room.
Yep. What else?
Some of the cleaning agents.
Yeah. Yeah. What if you work in an environment that has particular chemicals, has a lab, and there's a chemical spill? Do employees know how to protect themselves from harm from a chemical spill? The other another role of the occupational nurse is, we know that we spend about 1/3 of our life at work. That's the estimate. So we bring a lot to work, right? A lot. We may be involved with counseling with of employees who may have substance abuse issues, counseling with employees who have mental health issues. in larger organizations is typically a program called EAP, Employee Assistance Program. It's called different things in different organizations, but I know it as an EAP. So anybody heard of those or have those in your organizations where you can tap into the resources for mental health or substance abuse or anxiety or depression? Anybody heard of those?
We have like a employee helpline
Mhm.
that will provide you with like financial assistance and like debt consolidation
Mhm.
and stuff for mental health
Mhm.
and substance abuse. You just call the hotline and they keep it all confidential.
Sure. I mean, think about it. Think about what issues people come to work with, right? They're not just
Or what issues we walk away from work with. I mean, our line of work can even be traumatic for us or sad for us.
Absolutely.
When you put all your investment into another human and then something bad happens to them, it can be really depressing.
Right. And so based on what Megan said, a lot of people, lots of employees, lots of your coworkers have issues they're coming to work with, whether it's personal issues from home, whether it's financial issues, whether it's, violence issues. A lot of people come to work with things on their mind. Do they not? Of course they do. So one of the occupational health nurses' roles is to screen for that risk. Try and get employees the help they need. We do this here in our roles as faculty. When we have our meetings with campuses every week, if we have concerns about students, we bring them up, right? And it's in an attempt to help the student cope better, have more resources. That's what Well Connect is all about, right? Everybody's going to work thinking about something. Everybody's coming to class thinking about something, right? Everybody. So one of the things that's critical in the occupational health world is trying to maintain a safe and healthy environment. Okay. The occupational health nurse also tries to do primary interventions, health education. Okay, maybe training or programs on balancing work and life, personal life and work, positive lifestyle changes, educating to help to reduce injury or disease. Okay, maybe smoking cessation programs, exercise and fitness opportunities. Some employers provide access or gym passes, smoking cessation, gym passes, weight and nutrition control information or prevention or classes, helping employees monitor chronic diseases. So that's what occupational nursing is all about. It's all about the workplace and keeping employees educated and safe in the workplace, thus to prevent illness and injury. Has everybody heard of OSHA? You should have. You should know what OSHA is. Occupational Safety
Hazard Administration.
So there are laws developed. There are guidelines put in place for safety in the workplace. Okay, in every workplace, whether it's a fast food place, whether it's a bank, whether it's a hospital, whether it's a office building, there's always safety standards in place. They look different in different organizations, but there's always a set of safety standards. If there's an issue, let's say there's been an unexpected death in the OR, or let's say there's been a number of falls outside a building that have to do with the workplace, OSHA will come in and investigate. You know, what was going on at the time? What protocols were followed, what weren't? What kind of re-education needs to happen thus to prevent a reoccurrence? Okay, that's what OSHA's job is. They're the enforcers. They're the enforcers of those safety laws. Okay? They make sure organizations are in compliance with the safety regulations that have been set up. Okay? A couple of primary, secondary, tertiary examples. Primary with occupational health, teaching coping mechanisms. Maybe that's the in-service that the occupational nurse provides to help balance work and personal life. Providing healthy diet education, educating on the use of proper lifting, using proper PPE. Those are all preventative measures. Secondary screening, let's say you work in a plant, a big industrial plant that's noisy and loud. Are employees educated on the use of proper, let's say, earphones, right, to minimize any hearing loss? So a secondary prevention would be maybe an annual screening for hearing loss. Maybe blood pressure screenings. Screening for stress and burnout. Remember, secondary, we're trying to early identify any risk. And then tertiary, something's already happened. So let's say the employee's been injured. Okay, the occupational nurse is working with the employee and the physician to maybe have the employee come back in a limited duty capacity. That's called managing the disease, managing the incident, or managing the injury. Okay, let's say somebody's coming back to work after back surgery, and part of the restrictions or discharge informations are released to work say they need to wear a back brace. Well, it's up to the occupational nurse to ensure that's happening. Does the employee have the back brace when they come back to work? Right, that's all part of managing and treating. Okay? Questions about occupational health nursing. Environmental health. Just think about for a minute. Think about the environment you live in. Outside. Right? Or even in your home. Think about all the hazards in the environment that we kind of never think about. What about communities that live near airports or big transportation hubs? Think about communities that live near industrial sites, communities that live near highways, communities that live near water, lakes, rivers, streams. Communities that have a lot of crime and violence, right? Think about your own community. Let's say you were driving around your community in your car, which is a windshield survey. What do you notice? Is your community older? Is it newer? Is it clean? Is it dirty? Is it crowded housing or not? Are there parks for people to walk in, go out and get exercise in? Is there trash everywhere or not? Think about it. Think of all the environmental risks we have in our communities. Okay, we know that environmental hazards are responsible for over 1/2 of the diseases in the world. They contribute to over 80% of communicable, non-communicable diseases and injuries. We know that kids are much more vulnerable to environmental hazards. Okay, we know that pregnant moms are much more vulnerable to environmental hazards. We know that environmental health is determined by a few things: genetics, socioeconomic status, environmental exposures. Let's say genetics. You have a family history of asthma, you have a family history of autism, you have a family history of developmental delays. We talk families living in poverty, more likely to be exposed to environmental hazards. Crowded living, maybe due to crowded living conditions, hazardous waste sites, having the availability or less availability to quality foods, more high-risk jobs, living in older homes with lead-based paint, or working in buildings that are much, much older. When we're doing our environmental risk, things we have to ask, or risk assessment, things we have to ask is, where do people live? Where do people work? Where do people go to school? Where do people do their recreation time or outside time? What is their dietary history like? If they live near waters and streams and they eat a lot of fish, there's going to be a lot of mercury in that fish. How close do they live to factories? How close do they live to dump sites? How close do they live to transportation hubs? And think about all the chemicals in the communities, the chemicals in the schools, the cleaning supplies, in the workplaces, in our homes. These are all environmental risks, potential environmental exposures. Think about the rural communities or the migrant, working in agriculture and all the spraying of pesticides. Think of that risk. We know that there's over 30 million Americans that drink water that doesn't meet the EPA standards of safe drinking water. That's also tied into the soil. Water's tied into the soil. Think about these new developments going up in communities. The soil's been tested to make sure they're not building over an old waste site, and people aren't living on top of contaminated soil. There's lots of things to think about that you really never think about, right? Think about the air pollution. Okay, we know that 50% of Americans live in areas where the air quality doesn't meet the standard. We know the cars are the single most important, single greatest contribution to air pollution, followed by the burning of fossil fuels. Okay, think about living near power plants, waste incineration plants. Okay, we know that air pollution causes lots of respiratory issues, cardiovascular issues, cancer, immune system disruption, maybe reproductive health problems. That's what the Erin Brockovich was all about, is contaminated water. Big company PG&E was dumping contaminated chemicals into the water. It was trickling downstream to this small community in Texas. All of a sudden, the population, small population, cancer, immune system issues, birth defects, all resulted from this contaminated water. If you haven't watched the movie, it's a fantastic movie. It was an environmental disaster. Okay. Think about food contaminants. When I go to a fast food, if I go to a fast food or go to a restaurant, I just make the assumption that everybody is doing what they're supposed to be doing with regards to food preparation, personal hygiene, storage, right? I just make that assumption. But there are foodborne illness outbreaks, from restaurants or from contaminated food. We see recalls all the time. Lettuce, whatever, avocados, lettuce, recalls all the time from contamination. Okay. We do have the right to know what goes on. EPA, Environmental Protection Agency. That's what oversees all of these environmental laws and regulations. Okay, you can actually go into the EPA website and put in your own zip code. And it will give you what the high environmental risks are in your community. So environmental health, if you're out working in the community, is a big, big, big responsibility. Now, if you go into somebody's home on a home health visit, right? Let's say you're going into change a wound dressing. You'll be doing your own environmental assessment within the home. What are the risks in the home that you observe or that the client tells you about? What are the safety risks? There are rugs that slide all over the place. Is there outdated food in the refrigerator? Is there open cleaning supplies or potential environmental chemicals all over the place? Or is it safely stored, especially if there are kids in the house? So environmental health also includes inside people's homes. So pretty big deal. What kind of risks I'm just going to stop sharing for a minute. What kind of environmental risks are in your community or in your home, especially if you have kids? Nobody has any environmental risks in their community. I
would say access to resources where I live, because I live in a place that's very rural, like we've talked about. Like, I'm on the Eastern Shore. We don't have access to very much stuff, and everything is so far. So, like, for example, like I moved down here and I was pregnant. The closest hospital to deliver my baby was an hour and 15 minutes away. And that was really scary for me, because I'm like, well, what if I deliver in the car on the way there? That's a really long ride, So I would consider that a environmental thing
Absolutely.
too. We don't have all that stuff here.
Right.
I was gonna say sewage waste, maybe.
Sewage, absolutely. Yeah. Huge. I live right around the corner
Our
from
water isn't good here either.
water.
Like where we live on the shore, it seems like everybody has a ton of iron in their water. Like any house you go into here is stained orange with iron. So a lot of us don't even drink our water. Like, we have water coolers at our house that we get our like filtered water out of for cooking and stuff. We don't use it.
There's a classic example that Megan just provided.
I just have one question. Is there an issue with like there being high content of like fluoride in the
Sure.
water, basically?
Sure.
Because I
I
think
mean,
there's a lot of that out here.
Well, I mean, there's that's up for discussion. I mean, yes, you can read both sides of that argument. You can find people that argue that any fluoride in the water is unsafe, right? And then you can argue that you can find people that will argue that a low dose of fluoride in the water is safe. So, but that's an environmental health issue, right? I live right around the corner from a huge highway that goes from the East Coast to the West Coast. I-70. I mean, and it just seems over the years that the noise level from this highway and all these, it's the only way these big 18-wheelers get through. It's all I hear. It's traffic and trucks and cars and the smell of brakes coming down the hill, because I live at the bottom of a hill coming out of the mountains. Always a constant smell of burnt brakes, right? That's an environmental issue. That's an air issue in my community, right?
I just wanted to say the air in New York smells completely different from Pennsylvania too.
Exactly. And the water probably tastes different too. So that's all part of, you don't think of it, you don't really categorize it as environmental health, but it is. These are issues in our environment. Anybody else have any other issues in your own environments that you live in that concerns you, or that you know that the city or county is working on? And what about trash pickup?
Our roads are bad too.
Roads?
Like
Roads are
roadways, like I popped a tire a few weeks ago hitting a pothole, and I feel like the roads need to be safer for people. You hit something like that and you pop a tire, you could wreck. So
Exactly. Yeah. What about the cleanliness of your community? Or is trash picked up on a routine basis, or does trash sit out? Smell? Attract rodents? These are all environmental issues, environmental health issues. But we get in our cars and we drive around, and kind of you don't really see all this until you start talking about it, right? Like I said, on my food example, I just run through a fast food and just expect everything's been prepared perfectly. But what if the employee hasn't received the proper training in hygiene, storage, preparation? That can set off something immediately, right? So anyway, all right, let's talk about teaching or education. Barriers to learning. Think about it. Think about, you have a group of 20 people. You are the nurse in a clinic that's responsible for health education. And you're bringing 20 of your employees to have to attend a mandatory training with you. I don't even know what the topic is, but they're coming to you for training. Let's say it is about somebody give me a topic so I can use it. What are we training about? The importance.
Hand
ahead.
washing.
Okay, we're going to train on good hand washing. Great. Okay, you got 20 people in the room. Okay, these are your peers. You're going to have 20 different kinds of learners, right? Everybody learns in their own way. Okay, some learn, but we'll get to the types of learning, but we know that okay, I'm going to hold off on, we're teaching about hand washing for a minute. Let me give you the general overview. We know that patient education is one of the most important parts of our role as a nurse, and it always will be. It doesn't matter what area you're working in. We're always going to be doing patient education if you're working with patients, right? Why do we do patient education, right? Sometimes we do it as a primary, a primary reason, which is to prevent. Okay? Sometimes we do it as a secondary intervention, which is we've identified this client is at risk for obesity. We've identified this client is at risk for hypertension. Now we're going to do our secondary education to help try and reverse that. Okay, so it doesn't become tertiary. And then we're going to do education at the tertiary level to help them manage or treat a disease. Okay? We're going to do education to improve behavior, right? We're going to do education with patients and their families about certain conditions to help them move towards being able to care for themselves. We know that with patient education, patients that do take a personal responsibility for their health and want to learn about how to manage something that they're at risk for and may have, they're much more apt to changing their behavior if there's more personal responsibility. Education empowers people, powers employee, whoever's being taught. Okay? Education, if you're dialed in, empowers patients to be knowledgeable and motivated about helping them care for their whatever they have. Right? We're educating in every role we work in. We talked about low literacy. One of the most important learner-related barriers is low literacy. Okay, nurses often deal with individuals or populations who are either illiterate or have low literacy levels. You think of all the cultural diversity in our cultures. Think of all the language barriers. Think of all the different cultural practices that we potentially are working with. There's a high risk for low literacy. And I don't mean literacy is condescending. I mean literacy is not understanding maybe the language, the information, not being able to comprehend it. Some may be embarrassed to admit that they even have an issue, right? So how do we really know that they understand what we're trying to teach them about, say, with regards to discharge? We talked about this in a quiz question. One of the ways nurses can assess a client's ability to read is to have them read something, read a printed instruction. Maybe if it has to be in a different language, have a printed instruction in their primary language. And then being able to discuss that with them. If you don't understand the language, get an interpreter. Okay. Family members we talked about briefly, but I mean, how do we know the literacy level of family members? Okay. Motivation plays a large part in people's ability to learn. Okay. What we hope is that our clients have the desire to return to independence, have the desire to return to the comfort of their own home, if they can learn from what we're teaching them about whatever they have, right? The goal is for them to return home independently, and hopefully that's motivation enough for them to participate in the patient education. We know that lots of different cultures have personal values and beliefs and practices that we try and incorporate into the health plan. I mean, most we can, some we cannot accommodate. Okay, but the goal is that we are aware, we are culturally knowledgeable about patients' cultures and values, beliefs, practices, and they verbalize that to us, and we try and put that as part of the health plan for them as we're working with them. There's 3 ways people learn. All of us. There's 3 ways all of us learn. We either learn visually, visually, obviously through seeing, auditorially, obviously through hearing, and then kinesthetically, which is the doing. right? Performing the task, holding the glucometer. Okay, one of these routes is usually dominant for each one of us. I'm a kinesthetic learner. I like hands-on. Okay, I just can't look at PowerPoints and learn from those. I need to get hands-on and do the doing part. Okay, and then the 3 different domains of learning that we all possess and should all be taken into consideration when we're teaching are cognitive, right here, cognitive, affective, and psychomotor. Okay, cognitive is the thinking part of us, right? Our ability to read information, understand it, memorize it, using it later to solve problems. So the thinking part. Affective is the feeling part. How are we feeling about, are we engaged in the teaching we are doing, or are the clients engaged in the teaching that's being given to them? Right? What are their attitudes? What are their feelings? What are their beliefs? What are their values? That's all going to affect their ability to learn. It will also affect your ability to teach. Do you believe in what you're teaching? And then psychomotor is the doing, the moving part. Right? So you learn the skill through practice and experience. So take the glucometer, for example. As I'm working with kids in the schools, the newly diabetic kids, and I'm trying to teach them how to use the glucometer. They have one and I have one. They are practicing hands-on with the glucometer, not watching a video from YouTube or reading a pamphlet. They're actually holding the glucometer and practicing with it. That's your psychomotor, the doing. Okay. A couple things about reinforcing health education. Right. Obviously, the ultimate goal for patient education is the prevention of illness, promotion of wellness, restoration of health. Those are the outcomes. Right. We teach patients about their diseases or their disorders. So, for example, we want to make sure patients have all the information before they go into surgery. We want to make sure patients have all the information on how to use their oxygen when they get home. Okay. As far as discharge planning. Oh, let's go back to our example that we're teaching about hand washing. So you're in a group with all your peers and you're tasked with teaching good hand washing. What I want you to realize is in that group of 20, you're going to have people that learn cognitively, learn affectively, and learn the psychomotor way. Okay. You're also going to have people that need to visually see something, need to hear something, need to practice doing something. My point about that the group of 20 was you have to know your room. You have to know your audience. You have to know that as you plan your trainings, you're going to have different kinds of approaches to learning. You're going to have different kinds of ways people learn. What if you're teaching a group that's visually impaired? How do you tailor to that? What if you're teaching people that are hearing impaired? How do you tailor to that? My point is that in a group you're teaching about whatever subject, you're going to have all different kinds of learners. And so you have to be able to meet the needs of those different types of learners. Okay. If you want to read, I want to go to the case study. If you want to read about prevention, education, so here's some more examples: primary, secondary, tertiary. Okay. And the last point I'll make, and this is so true. Learning has not occurred until you see behavior changes. Right? We know that behavior changes are hard. It's our nature, it's human nature to migrate towards the path of least resistance. Okay? Change is a cyclical process. So I'm going to leave you with this. Does anybody work with anybody who would rather just do it the way we've been doing it for 30 years? Anybody work with anybody like that? Yes, we all do. Right? We all work with the old nurse who said, "Oh, we've been doing it like that for 30 years. Oh. Well, there's just been some recent studies by our education department that determine that if we do this with our stroke patients, we implement these changes with the way we care for our stroke patients, we can actually get them home a couple of days earlier." Well, who wouldn't want to do that, right? But then you have but it requires training sessions of new products we're using or new protocols we're doing or new policies we're doing, right? It requires a lot of work to get to that point, to get everybody on board to make this shift. But you always got your people, right? They're saying, "Oh, nah, we don't need to do it that way. Well, the way we've been doing it is fine," right? Change is hard, right? But remember that as nurses, we're always trying to improve outcomes and processes for our clients, right? I'm always, I'll use myself, I'm always trying to improve on the way I deliver this class. And I do that through feedback, right? Or evaluations, right? So my point is we should always be trying to do it better. Does that make sense? But it's hard to change. I don't have a hard time changing, but we all work with people that have a hard time changing, right? And that can be frustrating. So anyway, that's my deal on working with people who it's hard to change behavior. Learning, if you truly are learning, it requires behavior changes. Okay. Questions before I throw you into a breakout room. I'm going to put you in a breakout room just for a couple of minutes. There's a case study. Somebody's going to need to pull up the case study on their computer. It was in the week 6 announcement. It's at the bottom under your blueprint notes. It says week 6 case study. All right, so I'm just going to put you in a breakout room for a couple of minutes. Talk about, if you're in room 1, you have question 1. Room 2, you have question 2. Room 3, you have question 3. And then we'll come back and talk about the answers. And I have a rationale for answers and rationale. And when I send out this recording in a little bit, I'll also send out the full case study with the answer and the rationale. So if you want to reread through it, you can do that. Okay. So somebody pull up case studies when I get you into a room and talk about your question, then we'll come back and talk about it. Okay. Jasmine, did you get the invite to join your room? Morgan? You should have an invite to join. You guys working on it? Brandy, Jasmine, Hannah, Clarence, you guys working on question 1?
Reading it.
Oh, okay.
Yes.
All right, cool.
Room, but if we're question 2, I would say C is the appropriate objective because it's smart. It has the time and the goal and how we're going to see it done. And that's just
You guys doing okay?
Yeah, we
Yeah,
have the
okay.
answer already.
Yeah.
You're ready? Okay,
Yeah.
Yeah.
awesome. Let's just wait for the rest of our group. All right. Let's talk about this. Everybody see my screen? This is what I'm going to send to you. It has the actual answer and the rationale, if you want to reread it. So, group 1, room 1, what did you come up with?
We picked C.
I mean, you have to you have to know what the learning needs are, right? You have to pick a topic before you can develop a program, right? So a core public health principle is asking learners to participate. First, they have to you have to identify what their learning needs are, right? Because when you develop a program, you're going to be designing it to meet their health needs or problem in that population, right? So, right. First, you have to identify the health needs. Okay. And then, right, you go to A. What are their health needs? Select a topic from those health needs. We have to consider the health literacy, right? And selecting an environment. Where out in the community you're doing, or where in the hospital you're doing it, or what's a comfortable environment for everybody? Are you going to do you go to a group center? Do you go to a rec center? Do you do it in the home? Do you do it? Anyway, that also has to be considered. Okay, number 2. What did you come up with? Room 2.
we chose C because it's asking about an objective or a goal, and C is the only one that fits all of the like smart components. Like it's timeable and it's attainable, and it's something where we can see that the children learned because they're performing it for us. So we chose C.
Yay. That's awesome. What a great answer. That's exactly. Megan just explained it. Right? We know that objectives, you're asking what would be an appropriate objective? Objectives are specific, they're short-term criteria, that are met in steps toward achieving a long-term goal. So yeah, excellent, 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 excellent. Right? And number 3, what did you come up with? Room 3.
So we chose B, but I see that the answer is A. But our
Right.
thinking was that because he is promoting about health and then he's going out and smoking, I think that's where we came to the lack of knowledge.
Well,
But I
wouldn't
can
wouldn't you see it as
understand.
more of a lack of credibility? I mean,
I
he
understand that
yeah,
now.
yeah.
Like
He
I
probably
get
has the
why.
knowledge. He's just not walking the walk,
Right.
right? And what 3 is, and I didn't mention this, but yes, we have learner related barriers, but we also have educator related barriers. And this is an educator. I mean, not all educators are perfect in what they do, right? They have issues as well, right? This is considered a lack of credibility. Okay. We have to assume that he's got the knowledge about it. He's just not practicing that. I always giggle when we go through this question. It's like, oh my God, really? Really? So here's just a quick rationale. Lack of credibility with respect to a certain topic is a common educator related barrier. All right. So how can we increase our confidence with teaching? Right? We can be prepared. Know that we're using useful information. We know our audience. Okay. Doing what this guy's doing is no. It's a no. No. So anyway, so this is a good example of an educator related barrier. Right? So pardon me. So I will send that along with you if you want to read through it again, because it does have some really good information in the rationales. I like the rationale for the second question as far as learning objectives. But where is Megan? Megan did a phenomenal job of explaining how you go from having an objective to teaching. So great job, you guys. Great job. So we covered a lot today. Hopefully you learned about occupational health nursing, or at least occupational health, environmental health. Teaching and health education is something that evolves. It's evolving through our whole nursing career, right? You do something the wrong way once, you figure out what went wrong, do it different the next time. It's just kind of human nature, right? Especially if you're in health education. So, all right, listen, it's Friday. I'm going to get off. I'm 5 minutes late, so I apologize for keeping you guys on. I need to get prepared for my exam 2 review, which starts in about 15 minutes. I will send the recording of the class, the case study, and one announcement. And then later on today, I'll send the recording from the exam review if you're not able to attend. Okay. I hope you guys have a good weekend. Remember, coming into next Friday in your exam, if you find out going through next week as you're preparing for your exam, there are concepts that you're still struggling with, please reach out and schedule a time to meet with me and we can go through it. Okay. I offer that to everybody. Anytime, any place. Okay. All right.
Thank
Have a
you.
good weekend. Yeah. Have a good weekend. And I'll see you.
Have a good
Yeah,
weekend.
we'll talk soon. Okay.